The National Governors Association sent a letter to the President of the United States. I am the chairman this year of the National Governors Association. Last year I was the vice chairman. We asked to meet with the President to discuss how this is supposed to work between the federal government and the states. Today, the NGA is releasing a letter, which is a compilation of questions from governors all across the country. Democratic governors, Republican governors, 36 questions from the governors sent to the White House. Basically, how does this work? We understand the concept, but how does it work? Some of the questions: how will the vaccine be allocated to states? What formula is used? In other words, are you going to allocate it by infection rate? Are you going to allocate it by number of cases of COVID? Are you going to allocate it by population? Who determines how many each state gets? What's the basis that you're using? Is there a national strategy on the prioritization? In other words, is the federal government going to say, I think nursing homes should get it first. I think nurses should get it first. I think doctors should get it first. I think anybody over 70 should get it first. Is the federal government going to do that prioritization? Can they tell us if they're going to condition the release of vaccines, right? The vaccines are controlled by the federal government. Are they going to turn around and say, well, we won't give you the vaccines, New York State, California, unless you do X, Y, Z, right? And can we know that now? Is there multi-state coordination? On our own during COVID, we coordinated with the northeastern states, New Jersey, Connecticut, et cetera. Is there a multi-state coordination piece here, or is everybody on their own? Am I responsible for all of New York and there's no connection to New Jersey, there's no connection to Connecticut, there's no connection to Pennsylvania? And who is going to pay to do this? New York State is already $50 billion in debt between state and local governments. And they have not passed legislation on the state and local relief. If the state has a deficit and the local governments have a deficit, we can't fund essential workers. That's who gets cut when you cut state and local governments. And now you're going to want us to undertake this vaccination program, which frankly requires more essential workers, not less. And they're talking about a vaccine possibly in December. You know, we're here in October. This is just a few weeks to plan this massive undertaking. Let's learn the lessons from the past 7 months. Otherwise, we're going to relive the nightmares that we have lived through, right? Let's not repeat the mistakes of March, April, May. China virus, China virus, China virus. No, it was a European virus. It came from Europe. Well, only people who can spread it are symptomatic people. It's when they sneeze, when they cough. No, wrong. It was asymptomatic people. And we weren't told that. So we never screened asymptomatic people. And that's how the spread continued, because we thought it was only people with symptoms because we were told that. Well, you need to wear masks. But we couldn't find masks. And we couldn't find PPE. And you had states competing with other states to buy masks and gowns from around the world. Well, we have to test. Okay, but there are no test kits, and there are no supplies, and there are no Q-tips, and there are no ventilators, and there are no reagents. We can't go through that same confusion again. It's not a question of knowing what to do. It's a question of knowing how to do it. We know what we need to do. We need to control the virus. We need to take more tests. Now we need to do vaccines. We know what we need to do. How do you do it? How do you do it? The devil is in the details. How do you administer 40 million vaccines in the state of New York? That's the trick